What's up, everyone? Today we are on the MIM podcast. Today we have Darnell Gordon. This is someone who I actually met on social media. It's so crazy in this modern day and age. You can meet so many people through Instagram. I follow a lot of medical students and a lot of people that look like me that inspire me along the way. And he's one of the guys that I followed on Instagram that has kept me motivated throughout my medical school journey. And it's so awesome to have him today and see him in person during this COVID era. But we're meeting up in person, having our first live podcast interview. And today I want to welcome Darnell Gordon. He's a fourth year medical student at Loma Linda University School, Loma Linda School, University School of Medicine. Yes. And I'm so lucky to have him here today to talk about his medical school journey.
Thank you.
So, all right, Darnell, I want you to just give us a little bit about your background. Explain a little bit about who you are.
Okay, sure. First of all, Darnell Gordon. I am from Riverdale, Maryland. My parents are Caribbean. My dad's Jamaican. My mom's Guyanese. So I grew up with a very Caribbean influence.
Best of both worlds.
Yeah. So growing up, from food to dancing, music, everything, definitely took up to that, and also the I wouldn't say the work ethic, but the pressure to succeed. Failure was not an option. And so that definitely did help to propel me. I definitely had a village that helped to raise me. Another thing that I really gained growing up was, at least in my family, they were very big on giving back to the community and helping others. And that's something that became a core of who I am. And so that's a little bit about me.
Awesome. Do you mind playing a little trivia game? You say your parents are from Jamaica and Guyana, so
yes.
I want to test you a little bit and see what you know about these countries.
All right, let's go.
All right, first question: what is a gazada? Is it savory dish or is it a sweet dish?
I'm sorry, gazada?
Gazada, yeah.
I'm gonna guess sweet.
It's sweet. Okay. You got that. That's a Jamaican thing.
Lost my Jamaican card already.
Which of the following games did you most likely play with your family growing up? You have three options: Dominoes, Scrabble, or Monopoly.
Okay, that's Dominoes.
All right,
sure.
Bingo. Let's go. Which of the following condiments would you definitely have in your fridge at all times in a Jamaican household?
Okay.
A, ketchup. B, relish. C, hot pepper sauce.
Hot pepper.
Yeah, we gotta put the extra A on the A. You feel me? Not the ER, but the A. All right, next question. Vicks Vapor Rub was religiously used in your household, true or false? True. In a Jamaican household, that is always kept inside the medicine cabinet. What is a duchy?
A duchy?
Yeah. Or what do you think it sounds most closely to?
It sounds like duppy.
Oh, yeah. That is also another Jamaican saying, but that's not what I'm talking about. In the kitchen.
Okay. I don't know if I've ever heard that term before.
Okay. Dutch pen, does that ring a bell?
Probably if I saw it,
yeah,
but not by name.
Okay. In the kitchen, they usually have like a pot, and they call it a Dutch pan.
Okay.
It's like a metal steel pan.
Yeah. Absolutely.
What is the name of Jamaica's national fruit?
Akeem.
Yes. There we go. And lastly, what is the Jamaicans' motto? No problem. We are one, or out of many, one people.
Out of many, one people.
There we go. So he got his Jamaican card. He got all of them pretty much right, except for maybe one or two. All right, let's go to Guyana.
Uh-oh.
What is Guyana's official name?
What is the official name?
Okay, yeah.
Oh, the land of many waters? Or
no. All right, but multiple choice options.
Okay.
Dutch of Guinea, Guyana, Cooperative Republic of Guyana, British Guyana.
British Guyana.
No. Cooperative Republic of Guyana.
Wow.
Yes.
Today.
Which of the following places is the capital of Guyana? I can even. Albon, Linden, New Amsterdam, Georgetown.
GT, banana.
Georgetown all day.
Georgetown for sure.
In which year did Guyana gain its independence from Great Britain?
Ooh.
Taking it back. History.
Man. Ooh. Can I get like a...
All right, yeah. 1763.
Okay.
1966.
Okay.
1831 or 1970.
I think it's 1966.
Yes, sir. Yes, sir. Got that in the bag. And lastly, the last guy in. How many countries share borders with Guyana?
All right. So there's Brazil, Venezuela, Suriname. I'm going to go 3.
Yes.
Okay.
There we go. There you go. You got it. You got it right there. All right. Perfect. That was good. That was good.
Okay.
So you got your stripes.
Okay.
Got your stripes. All right. So let's get back into it.
Yeah.
So medicine.
Okay.
So what got you interested in medicine? How did you figure out that you wanted to become a doctor?
Sure. So how I got into medicine was I got tricked into getting into medicine. I put it that way. So it's glad that we mentioned the Caribbean side. So I went to undergrad at Oakwood University. It's in Huntsville, Alabama. Mm-hmm. And when I was there, the food in the cafeteria was no good. It's gotten better since then, so I hear, but it was not the move.
Dang.
So one of my professors, I was in like a basic science class. I was a IT major, computer science major at the time. Mm-hmm. So the professor, he was Trinidadian, and he said, "Hey, I know you guys don't want that cafeteria food. Come to my house. I'm cooking some curry and roti." And well, I didn't hear anything he said after that. I was like, "I'm there."
You're in.
So I went there. We went in this van,
mm-hmm.
And then we went to this house. And then when I got inside, I realized that it was food there, but it was more than that. It was actually a mission group interest meeting.
Oh, wow.
He didn't mention all of that. And
right.
So it was for the National Association for the Prevention of Starvation.
Awesome.
And so I was like, man, if I drove, I probably would have been out. But, I'm here for a reason, so let me learn more about it. Mm-hmm. What really caught my attention was that there were young people that seemed so passionate about helping others.
Right.
What I was used to is like if younger people were helping, it was because they were being forced to by their parents. They needed community service hours, not just because they just wanted to. They just had that desire.
Right.
And so I was like, you know what? I came for a reason. They're going to go out in the community with the doctor the next day. Let me just go and see. Mm-hmm. So we went out to this community and we went with the doctor in like a medical mobile unit. And when we first hit the community, I could see that everyone was just like, they had their apprehensions, their doubts, like, are they really here to help? What are the motives, whatever. And as we administered care, I just watched how faces changed from, being doubting and really didn't really trust what we were coming to the table with, to just being so thankful, hugging us, just smiles everywhere. And that's when it just clicked in my mind, like, man, I want to help people. I want to help disadvantaged communities by being through medicine. And I just changed my major the next day to biology.
Wow.
And that was it.
You had a revelation that night.
It was just like clicked. It was like, this is it.
That's good. That's good. I know oftentimes during this journey, a lot of people can look at certain pillars and certain experiences and times where they knew that, all right, this is actually it. Did you have anyone in your life besides, these people from the missionary group who you looked up to as heroes to help, motivate you down this pathway?
Absolutely. I mean, another thing too was my personal experience with my mom. So growing up, this was maybe when I was 13 or so, or 12 or 13. I remember coming home from school one day and I just saw my mom shaking. It was like, Mom, what do you, stop. I didn't understand what was happening. Like, why are you shaking like this? And that was when my mom had like the first seizure that, we've known about. And so basically a little before that, she had gotten into an accident and had a traumatic brain injury. And so she started having these seizures. And so at first, when, she would always, at first it was just that happened once, and then it just continued to happen at just random times. You never knew when it was going to happen. And I just watched how, whenever let's say she'd have a seizure out, let's say at a restaurant or whatever, they'd call the ambulance. And so I just remember going to the emergency room so many times. And it was during that time, I mean, without even realizing it, I think that's when I was actually first really introduced to medicine. Just watching my mom, watching people take care of my mom. And I just remember at first going to the emergency room was always scary. It was like, man, what's going to happen? Am I going to lose her? But I think after a while, it became more of a sanctuary. Like, man, I need to get her to physicians, to people who can take care of her. And I think just watching my mom go through that process is how I really got involved and interested in medicine, even before, even maybe subconsciously, and then of course going through that, the experience I talked about earlier, going on to that community kind of more cemented it.
With this experience with your mom, was this throughout undergrad for you or was this before?
So this was actually in high school.
In high school,
well,
okay.
middle high school.
Okay, so it helped shape your early years
Right,
to
right,
then
right.
go down that way.
Right, and even adding on to that, I mean, my mom, despite of all that she was going through, she was still out there helping so many people, so much. I'm like, Mom, like, why are you giving so much for other people? You're going through so much.
Yeah.
And she would be doing clothing drives, all kind, helping the homeless, all these different things. And
Being
I just,
selfless,
right. And I think just watching those characteristics from my mom growing up, being introduced to the medical field, just, being or in the hospital so many times, is a part of the things that kind of drew me, into medicine.
That's awesome. And so that was in high school. So when you actually got to college and you started taking the pre-med classes, or first you said you were computer engineering, and then switched to pre-med. So when you finally switched over to the pre-med classes, how was that pre-med experience like for you overall? Today's podcast is sponsored by Mission to Medicine, a lifestyle brand that represents high achievers who are pursuing and actively living out their dreams of being healthcare professionals. Check out the latest merchandise online at www.missiontomedicine.com. Use discount code MissionToMedicine10 to save 10% off your purchase.
Man, it was tough. I mean, I felt like I had no time. I mean, especially because I was very active. I'm one of those people, when I get started in something, I put my mind to something, I give it my all. So I was very active in the mission work. And so that took a lot of my time. And school definitely took a lot of my time. All I remember is having an exam, a lab, constantly. Something, I had multiple things to study for. So it was definitely challenging. What helped me to get through that, I think, was just mentors. Like, I had so many mentors. And I had like different levels of mentors, like mentors from, or people who I looked up to that were maybe a year or 2 years above me. Then I had, people who were already in medical school. And then I had mentors that were actually physicians already and things like that. And so those people, telling me I can do it, giving me tips and tricks, all those things were definitely helpful in the process. Okay.
Could you expand a little bit more on some of the challenges or some of the course load or coursework that you had difficulties with, and what tips and tricks did these mentors give you to overcome those challenges?
Sure. So I think, there were certain classes more than others. I'd say like organic chemistry was definitely one of those, like Achilles heel classes. And our school, genetics actually was a tough class. We called it the litmus test, because there's other classes where, even anyone could theoretically do well in, but genetics, she made sure that she changed the exam every time. She it was like multiple choice, written things. It was very much, you had to know the material. There was no finessing at all. And that was definitely a challenge. I think some of the tips and tricks that I gathered was, one, before I did a class, I would always try to find someone who took it before and say, what worked for you? What do you recommend? So that was one of the main things. Even in medical school, we didn't get there yet, but that's kind of the same approach I always did. I don't want to reinvent the wheel. Like, if someone's already done it, if there's a resource, that would be good trying that. And then if I ever had struggles past that, I would try to talk to the professor, see what they'd recommend, and times like that. Those are, I guess, general things that I felt like helped. And the challenges was more just overall the workload, the amount of things to study for. And I guess looking back, I just thought, I need to study for this to pass the test. And that's one thing that I regret the most. I wish that I just spent more time. Of course, I wouldn't remember everything, but actually just trying to learn and enjoying the learning process as much as possible, because it comes back. Like, years later, things that I saw in undergrad came back again in medical school. And so I just wish that I actually had a better foundation, instead of just, study this for the test, forget about it, move on. And even before that, even for MCAT, same kind of concept. Like, there's so many things that I studied for, and it's like, yep, I got good advice on what to do for this class. I studied for it. That's out of my brain now. What's next? But it's more so, I wish I built on those things instead.
I see. I like one of the things that you mentioned. You said that you reached out to upperclassmen and other people who already took the class and got their feedback about it and how they approached it. And I think that's always good. And it's good when you have that type of community and camaraderie where you can go to people and get that information from. I know sometimes the pre-med community can be deemed as cutthroat or not really willing, people withholding information and having a lot of negativity surrounding it sometimes. Did you experience any of that in undergrad? And also, did you have any feelings of imposter syndrome? And if so, how did you overcome those negative feelings?
Sure. I think one of the benefits of going to a HBCU, which is what Oakland University is there's not as much of that. Of course, wherever you go that exists, but it was more the opposite in my experience. People were always willing to reach out to help. And it was more like, hey, if I figured out a good resource to use, I'm not just trying to keep this to myself. I'm like, yo, I have friends. One of my good friends, Tino, is at University of Louisville in medical school. And I just remember there's so many times where he, just making sure like, hey, did you remember to do this assignment? He'd be like, oh man, I definitely forgot about that, or vice versa. Or, hey, here's this, good thing that was recommended to read or to look over to do that. And that definitely helped. And as far as, imposter syndrome, man, I definitely felt that a lot. I felt that then, but I felt it a lot more when I left the HBCU system, because one thing I appreciate about being an HBCU is that there's so much uplifting there. You just feel like you can do it. It's so, I just felt so empowered as a Black man that, I am intelligent. I'm able to get this material. It's not too hard for me. It's not above me. I'm watching other people who look like me also do this and accomplish it. And that was very helpful for me, getting that experience with imposter syndrome. But definitely I felt that a lot more when I came out of that, bubble in a sense, and went and, started medical school at a, non-HBCU.
That makes sense. So you started medical school at Loma University School of Medicine. And so what was your experience like for your first year as an M1, that transition period from undergrad to medical school?
Right. And so that was definitely challenging, one of the most challenging parts of medical school. And I tell people this all the time. I think the first initial challenge or thing you have to get over is figuring out how you study and how to be efficient. So
I heard that's like one of the hardest things, learning how to study, especially in medical school.
Right, because you just have to be efficient. And that was the toughest thing. It was just so much information. It wasn't even that it was hard information. That if you did each class individually, it wasn't that this was so hard to understand. But if you combine everything all at once, you're just like, as you're remembering something, you're forgetting the other thing. Like, man, I just went over this a few days ago. I already forgot what vessel this was, or, what
information overload.
Yeah, absolutely. And I remember going through I remember studying, before I got to medical school, I researched all these different things. What was the most effective ways to study? I was looking at spaced repetition. I was looking at Anki.
Shout out to Anki.
So at first I started using Anki because I was like, man, this is what I need to use. And, everyone's using it. And so I did I started doing Anki. And I did my first exam, and I did not do well on that exam. And I think one of the things about me is I'm always self-assessing, always trying to grow, and looking back at what I did and how can I improve. And so I was like, man, okay, what went wrong? And I started to realize that when I was using Anki, I was just focusing on, just getting the material, like memorizing, just memorizing facts,
facts,
instead of getting the concept,
understanding the concept.
Right. And so I think I just went straight to, okay, we went over this lecture, bam, memorize this. And when on the exam, it wasn't presented in those exact ways of a fact. When it was more the concept, then it was things where I didn't do as well on. And so that was definitely the most challenging thing. And then adjusting, because I tell people this all the time, like a lot of times going into medical school, most people are used to being somewhere near the top of their, maybe their pre-med class, whether, they're like, or even just in general in their school, like they have good grades. They probably have a lot better grades than most people in the school. So you're used to being a top student in a sense. And to come to medical school where only a few can be the top student. Everybody can't be the top student. And so you're kind of going backwards in a sense, like, man, what's happening? I'm not used to seeing grades I'm not used to seeing 60s and 70s. I'm used to seeing 80s and 90s. What's happening here? And I think that is also another challenge that I had to overcome. Like, these grades that I'm getting is not a sign that I can't do it. It's just adjustments that I need to make. And so I actually went against the grain. And I think that's why I kind of tell people you have to do what works for you. I went back to what I did in undergrad, which in most cases is not efficient, based on studies for most people, but reading and rereading. So but I just combined it into like spaced reading. So I would read, like I had high yield notes that was this resource that someone who took the class before, and he basically took all the PowerPoints and just made study guides for each one. So I basically used his study guides, I annotated them a little bit, and I would just have a reading schedule. Like I read this I want to read this through 3 times before the exam, and I had like a schedule.
How did you keep your schedule? Like, can you talk about that? Like, what software or program did you use? Did you handwrite it?
Yeah, so I actually hate paper and writing and all that, but I love using the computer. I actually use OneNote. So I had like a tab for each class, and then which is where I kept all the different study guides. And then I also had a tab which had the schedule of all the lectures. And I would make a check mark of every time I went through the lecture. And I'd have like certain days. And it was based on, which classes had the most material or the most weight or priority. So I would say like Monday and Tuesdays were, let's say, anatomy and microbiology. And then the next days would be this and this. So I just kind of grouped those days together where I know Monday I was going to be covering this. Tuesday I'd be covering this. So I tried to make sure I hit everything make sure I hit everything throughout the week.
I see. That's good. I know most medical schools, they tend to have their medical school preclinical information organized by blocks or in modules. At your school of medicine, did they have it that way? And also, what class did you think was the most challenging out of those?
Are you talking about like the first 2 years or just the first year?
The first 2 years.
Okay, yeah. So we had it more just like terms. Okay. And then each term we just had like certain classes. It wasn't necessarily by like a certain like system or block base, but it was just whatever classes we had in that term. And they tried as much as possible to keep it all together, but it just didn't always work out. So we weren't always going to just be doing working on cardiovascular related things on every subject, but they tried as much as possible. I think the most challenging subject at my school was pathophysiology would definitely be the hardest class. Before I even say that, I wanted to say, I think each class I had to adapt differently. Like in general, I realized that the first year that worked a lot better for me with the reading, and because how our school has it set up is that it's more the traditional way where you kind of do the old traditional way where you kind of start the basic science and then you kind of go into more of the pathology and the deeper the different diseases and things like that. And so based on that, the first year it was more rereading on a schedule space. But second year was definitely a lot more of using, I think the second year challenge is which resources are best to use. Like the first year is more what's the best way to study, how to study efficiently. Then second year, just so many high yield resources. And then you're also preparing for boards. And so I think that in of itself is a challenge. And I had to make adjustments class by class. And I think pathophysiology was a challenge because it was different than what the other classes I'm used to. So in pathophysiology, it was all about the concept. Of course, there's some, just you got to memorize this. But it was more, do you understand inflammation? Do you understand heart failure, the concept behind it? What's actually happening? Because it's not going to be, this was in the syllabus, is going to be the question. It's going to be, when heart failure, if you have a problem with your heart, there's going to be, you're going to have problems with backflow in the sense that you're not going to be able to pump the blood forward as well. Can't pump the blood forward as well. What effects are going to be happening downstream? Your liver is going to be affected. All these different things. So it might not say, okay, what is heart failure or what is but it may talk about this person. They describe a scenario where somebody is in heart failure, and then you'd say it would be like, what would you expect to see, or what are the effects? Right. And so that made me had to think kind of a little bit outside the box and like, man, do I really understand these concepts? And I had to really dig deep, but I was able to make it through.
Okay, that's good. You mentioned a little bit about preparing for boards.
Yes.
So that's step 1, step 2. So for step 1, what was that process like for you? What resources did you use, if you remember? I don't know, just an overview. You don't have to give it details.
No problem. I always tell this, I might be crazy in saying this, but I always feel like step 1 was not as bad as the MCAT. I think I would never take the MCAT again. So I want to encourage you guys that push through that MCAT. It's definitely a challenge. But you guys can do it. But the reason why I say that is because I feel like with step 1, it was all medical. It was all I have to think about is just the medical side. I didn't have to think about, physics and other things. And I think what basically I used was UWorld. UWorld was the main thing I did. Lots of practice problems, seeing where I went wrong.
Right.
In addition to using first aid was kind of like if I got something wrong, I would look at the whether right or wrong, I try to read, what they have in the explanations on UWorld. And then I would go back to first aid as well to see, what first aid said on it and kind of have that as in my brain, my map of what I look to. And then there'd be like certain class by class or like subject by subject things. Like for pathology, I like to use Pathoma, or just, these are all just high yield resources that are known to work for microbiology and for farm, using Sketchy Medical. So just kind of use a combination of those resources, but very heavily on practice problems even though it was tough, it's good to do the practice problems because you can see where you're getting wrong. Yeah. And it's also tough to go to those areas because it feels good to get things right, but you got to focus on those weak areas.
My biggest challenge.
You got to work on those weak areas. And so just putting in that constant work. For me, I'm very big on work hard, play hard. You've probably seen that on Instagram, maybe a lot more of the play hard side.
We'll get that.
But that's part of what helped me. I know a lot of people, they just kind of grind, and you're supposed to be on the grind, but they grind so hard that they're not balanced and they don't give their mind time to rest. And your brain, you're not a machine. You have to be able to encode the information. You have to be able to rest. You can't be too stressed that you can't receive information and very encode it. And so I think you just have to set a certain time and be consistent. What's more important is that you're consistent, and because if you're consistent, you hit a certain amount of time every day. If there's a day where you just don't feel it, and you just don't have it, it's not going to affect you that much because you've been consistent. But if you are inconsistent, that's when you have those days or those times where different life happens. Whatever things may happen in your life, you don't have as much of a leeway. Because you weren't consistent at the beginning.
That makes sense. And I know throughout the preclinical years, balancing extracurriculars and doing things outside of medicine, you're talking about not being a machine and not burning out, having other things that you go to also helps as well.
Absolutely.
I noticed that throughout your undergrad or throughout medical school, you were involved in SNMA.
Yes. And
so how did you get involved in that, and where did you end up going in that organization for leadership positions?
Sure. So how I really got involved with it was at a conference. So I knew about it, but I didn't really get involved with it because I didn't really understand fully what they were doing. But I just knew that there was people who I trusted, mentors. Like I said, it's good to have mentors who you trust. And they're like, you cannot miss this conference. You cannot miss this conference. Whatever it is, you cannot miss it. And I said, okay, what is so great about this conference? Let me go. And it was the AMEC conference, the conference that they have annually for all the different SNMA members and also the MAPS members to come. And so I went to that meeting and I was just blown away because I saw so many, and like I said, going back to the imposter syndrome, being an undergrad, I saw so many smart people who looked like me. And it just made me confident, I can do this, whatever. Going into medical school, I back into the minority again, back into people making comments after, we'd be going over assignments or we'd do group assignments and I would know the answers to things and people would seem shocked sometimes wow, you know this? I'd hope I know it. I'm in medical school, but, it's just, they may not be used to seeing someone who looks like me, understand things and on that level. And so, but to go to, at AMEC conference, it was the total opposite because I was able to see, wow, at this conference, there's people who look like me who are doing it, from all different things, from surgeons, to family medicine physicians, to people in medical school that are, at different top institutions, to pre-meds, it was just wow, all these people are doing it. And it just motivated me. And not only that, because that's one thing to see the Black excellence, but it was the Black excellence in the context of commitment to giving back. And that's what really hit me. It was man, not only are these people making it, but they're not just content with being here. They want to look back and reach back to see how can I get other people to be where I am as well, other people who look like me. And that was what got me. And I said, man, I need to be involved. So I literally ran the next day. They were running for positions for our region. And I was I want to run for the associate regional director. And I ended up running for the position. I got the position. I ran from the floor. And then I did that position for a year, and then after that, I served as the regional director, which I currently serve for Regional 1.
That's awesome, man. That's awesome. I really seen you take that organization up and get heavily involved. So definitely seen that it was noted. What ways did you de-stress as a medical student? I know you were involved in so many different things as far as leadership-wise, but how does Darnell Gordon take care of himself? Like, what do you do?
Yes. So personally, I like to hang out with friends and go out. And so I basically have it like this. I have a lot of responsibilities because I realize that it has the opposite effect. You have to know yourself. So for me, I'm a chronic procrastinator, right? And I know that I'm a procrastinator, and if I'm not pressed to do something, and what being busy allows me to do is it forces me to be efficient, because I have so many things I have to do. I have to actually I can't just let this slide. It'll all pile up, and I don't want to fail. And so that definitely helped me to be more organized. So I did have set times where I'm going to put in this work, and then I'm on the weekends was kind of my golden time. Like if I had an exam on Monday, I would study on Sunday. But if there was no exam on Monday or no major exam coming up that next week, the weekend was golden every weekend. Once Friday night comes, from Friday night to Sunday night, it was my time. I would whatever I wanted to do. If I wanted to go out with friends, if I wanted to go to the beach, if I wanted to travel, especially pre-corona, and when things were, when I remember just traveling so much, and I also appreciated about SNMA. It gave me so many opportunities to travel to different conferences, and so those were kind of the things I personally did. I just like being around people I care about. I love to dance. Like I told you, the music, Caribbean music. So anything soca, anything dance hall, I'm there. And I think that cleared my mind. And I know a lot of people who didn't do that. They were the opposite. They're like, I'm studying basically every day, and they were just always on the grind. And these are not people who were I would end up doing better than them in some classes. And these weren't people that I was just way smarter than. I just felt like they didn't have any balance. Like they were just, if you're too stressed and you're too worried and you just never give your time a chance to breathe, how are you, you can't retain information as much as you want to. And I think that was something I took seriously then, getting to this point, and I still will take seriously as I go into the next step, which is residency.
Awesome. And I think that's very important to note and highlight that self-wellness and self-care is definitely important, especially as a medical student where you're overwhelmed and constantly consuming so much information. You have to have a balance, and setting that schedule for yourself and knowing that your weekends are going to be golden for you. And as long as you got your work done during the week and you made that time set aside, it's good for you. And then you can de-stress and be ready for the next week and perform at your best. So that's really good. Yeah. And you mentioned about you're going to continue this throughout your moving forward down residency and pursuing your specialty. So now that leads me to my next question. What specialty you think you're going to be pursuing?
So I'm going to be going into emergency medicine.
Awesome. Why emergency medicine?
Great question. So, I think that emergency medicine for me was basically a journey. First of all, watching my mom, like I mentioned earlier, just being in the emergency all those times, I really saw the importance of giving people care when they need it the most. And that was something that really, as I went through medical school and learned more about the different specialties, because sometimes you really feel like you know the different specialties, and then you do a rotation on them where you get to see a little bit more, and you're like, you know what, this is not what I want to do. That's something I always took heart to, being able to help people when they need it the most. Mm-hmm. I also like the population. So, based on our current healthcare system, unfortunately, a lot of people go to the emergency room who don't need to be there. A lot of people don't have and especially this is like lower economic people from lower economical situations who don't have a primary care physician, or minorities who don't trust the healthcare system. And so you have these, or mental people who have mental conditions who are not properly treated, homeless population. So you have these populations that are in the emergency room for conditions, a good amount of them that they may not even need to come to the emergency room for. And so I just like the idea of being able to help these people and be basically help those who need it the most in that regard. And so those are the things that drew me into emergency medicine, as well as I have a lot of things I want to do outside of emergency medicine as well, as far as nonprofits, for getting resources to those for minorities, so that more we can get more minorities in health. I mean, I was looking at it today for residency, and they just basically put out the stats, the AMC, about the current amount of medical students, current amount of residents in their different ethnicities. And I was looking at it and I was just alarmed because in residency right now, I mean, it was estimate because they separated it by medical for MDs and DOs. But if you combine it, I mean, it wasn't more than like 6%, maybe 6%, at most 7%, maybe if you know, like being very generous, of Black people that are in residency programs. And that doesn't represent the population. You know, there's double that in the population. So it means that there's a lot more work to be done. And I want to be a part of helping to change that. And then different business ventures. And then also just wellness. I'm very big on wellness, and I want to be able, and I think emergency medicine allows you to have that wellness.
They do shift work, right, for emergency medicine?
Yeah.
So it allows for all of that.
Right.
Be flexible. That's good. Far as health disparities, I know you mentioned that emergency medicine takes care of everyone, and usually most people in disadvantaged situations. What health disparities do you want to combat as a physician that you've learned about throughout in medical school? Sure.
So I think the main ones are, and this is just so unfortunate, but the main killers, you know, if you think about it, a lot of them are preventable or to a degree. You talk about heart disease. You talk about diabetes. You talk about those who have hyperlipidemia, like high cholesterol levels. Like these are things that lead to strokes. That that you have all these different issues that could be preventable by proper health decisions as far as diet, being able to exercise. Just laws of health, fresh air. And I know that and I think that's where it kind of goes to that next level where certain communities don't have the ability to get access to good, healthier foods as others. And I think that's where you being involved in the community and working on programs or working on addressing those needs is important. But you have to first get them to understand the importance of their lifestyle and their disease. And I think those are the things that they may not understand as much, or not even understand as much, or accept as much, I should say, from someone who doesn't look like them, especially if you're talking about someone who's witnessed, the terrible atrocities that the medical system has done to people, certain people, and people of color. And it's just like you seeing that, them seeing that they may have a distrust for the system. And so being able to say, hey, I see where you're coming from. I witnessed that. However, this is true. And it's actually research shows. There's research that shows that when patients see people who look like, physicians who look like them, they're more likely to be compliant, and there's lower mortality rates. So it is proven that them seeing someone who looks like them, they're more likely to listen and take the advice that's going to be helpful.
Thank you. I know this year you've been pretty much busy finishing up your last year of medical school and not traveling, but interviewing on the interviewing trail. We're in COVID, y'all. So I wanted to figure out if you had any tips that you could give to pre-med students, medical students about interviewing in the COVID era virtually. Sure.
So the first thing I'd say is you want to get as best equipment as you can get, within your limits. So if you can get a ring light or something that can get, show you a bit better, do that. If you can, some people have microphones, nice cameras, things like that. Sure. Whatever you can, I think can add. If you have headphones, if you know that your computer, I know my computer camera is just trash, so I have to have a webcam that I attach on it, and so that's the basics. Secondly, you need to know your application and be confident in what you can bring to the table. So that's before you even step in anywhere, because you have to know your strengths. I'm going to tell you this. My strength is not, there's certain research. I've done research, but that's not going to be my strength. That's not going to be somebody's going to look at me wow, you are really great at research. You've accomplished these great things. That's not my strength. What my strength is I've been active in, from undergrad to now, I've been active in community service, and I've been active in fighting for diversity and promoting diversity in medicine. So those are my strengths. That's what I'm bringing to the table. Those are the unique things. Because I mean, at this point, everyone has grades. Everyone has all that it takes. Everyone checks these boxes. Now they're looking to see why you, and you need to know those things for yourself. And then when you come into these interviews, it's more of, hey, I'm just letting you know who I am. I think a lot of people overthink these things and get so worried when it's really just, these people want to know what it is about you that they should accept. Why should they accept you over someone else, other than the fact that you have good grades, or you have, you checked all the boxes, you did your away rotations, you've done this. Other than that, cool, someone else has done that. Actually, most of our applicant pool has done that. But why you? And I think when you know and you are confident about that and you just exude that, that's something that they can actually take to the table, and that's going to stand out, because when they write those notes, they'll say, you know what, he really cares about this as shown by this. Right. And I think that's basically what I take in the interviewing.
That's good. I know a lot of people recommend that you have a narrative, a story, that you can paint a picture, like giving all your experiences. It complements what you say. Like if you say you're about, social justice, if you're about increasing diversity, what actions have shown that in your past? Not trying to cookie cutter things, but doing things that you're actually passionate about and you can actually show. You just express that's how you do it, and that's how you set yourself apart from everyone else, because you need something that's going to differentiate you from someone.
Right. And on that note, I mean, it's definitely important to do mock interviews. Like I can't stress it, and practicing, and like you mentioned, like going over, there's certain things you're going to be asked. I mean, I can tell you that pretty much as a pre-med, you're going to be asked probably why you want to go into medicine. Mm-hmm. You should have an answer. That should not ever shock you. Like, I mean, in the same way, I get asked all the time, why I want to do emergency medicine, or why did you apply to our program? I have to be able to say, this is why. So you need to be able to have those basic answers. But there's certain things you may not have an answer to. Like I just remember being asked, like, hey, tell me about a clinical experience of something you did wrong and something you could have done better. And I was just like, I didn't have that off the top of my head. I had to take a pause and then okay, so this is something, be you're not going to be prepared for everything. I see some extensive lists where they'll have 100 questions you need to be ready to answer. Mm-hmm. Just know be ready to answer the main things first, for sure.
Okay, that's good. During your transition to clinical, going to the wards, did you have any unique experience that stood out to you? It was like, oh wow, this is really why I want to do medicine, or you had one clinical experience that just you remember to this day? Anything like that?
I wouldn't say that I had that kind of experience. Yeah. I don't want to lie, but what I would say that it was a challenge to transition. So I know a lot of people, they have the opposite experience where as soon as they hit clinicals, they're like, man, this is what I've been waiting for. Here are my stories. And for me, it was the opposite, man. I feel like I was used to studying and taking tests. I actually didn't mind studying all day and taking tests, because that's what I'm used to. That means I can dictate my own schedule. I'm studying from 8 o'clock to 6 o'clock. I'm going to take these many breaks, and when I'm done, I can do whatever I want to. Mm-hmm. And then if I put in this much work, I'm going to do whatever decently on the exam. I'm used to that. I've been doing that all my life. But what I haven't been doing all my life was actually treating patients and dealing with not just their illness, but who they are as a whole person. Not only on top of that, being evaluated, so being able to anticipate, what things might be needed in a certain situation, being able to determine, think outside of the box of how I can help this patient so that the resident load can be better. And I think those are things that I wasn't ready for, and that was such a challenge for me, and didn't come easy for me. And I had to develop an approach, because I realized this is something that I do want to do. I want to be able to provide good care to people, but I just know that right now, how I currently have it set up, I'm missing major things I should be asking. I'm not doing this well, and what I had to do was I had to create a systematic approach. And I think that was very helpful for me, where it's okay, when I go into the room, I'm going to do this, this, and this. Mm-hmm. I'm going to ask these questions. I create, they have so many mnemonics. I have a mnemonic for the questions I'm going to ask to go over the different dimensions of what they're going through, and, their history of their present illness right now. And those are things that definitely helped me. And overall, just the idea of, I remember this one time where we provided care to this family, and after we provided the care, it was this young boy was in the hospital, his grandma was there. And so after we provided the care, I just went back to the room, and I just just to talk. I didn't really have any other agenda. And I just was talking to her, and she just was like, thank you so much for caring. Thank you guys for what you do and for the time and the hours you put into making sure you know what it takes. And I think those are the things that make it worth it, just to know that I'm helping people.
That appreciation, it's always good to get that, because it reaffirms for you that, you know, what you're doing is not in vain.
Right.
So that's good. Thank you for sharing that. All right, so I have a lighthearted question for you. I know you say you love soca and you love dancehall music. Post-COVID, everyone, post-COVID, where would you like to travel first to a carnival or parade?
Okay, this is super easy. Easy. So I would travel to do a carnival parade, and at the best one in the entire world, the best one. And that, in my opinion, is none other than Trinidad Carnival. I actually went there for the first time in 2019. I was in the middle of second year. And a lot of people are like, how did you do that during your second year of medical school? And I still don't know how I did that. Wellness. But I did, and it was great. And it was just amazing. And for those who don't know what carnival is, it's just a way to just go out and just enjoy and vibe with people. There's a truck or some sort of person playing music, and you have this group of people in costumes, and they're just vibing out, enjoying the music, and, you know, just letting go. And it's like you worked all year. You've been grinding, studying, or working, and you just finally have this time where you can let go and just enjoy the music, and you're just out there on the road. It's great. And did I mention the food? The food is also wonderful, man, and I miss it. I can't wait to go back. It's obviously canceled this year. I'm hoping that it'll be back in session next year. And I don't know if my future program director is listening, but I definitely am requesting vacation days for our residency from now. I'll be the first one, so no one can say they got it before me. But I definitely got to be there.
Awesome. Thank you so much for joining us today on the MIMS podcast, Darnell. Everyone, this is student Dr. Darnell Gordon. I look forward to seeing your success this year in match. And I know that you're going to do great things, man. Thank you again.
Thank you.